Hello and welcome to Time of Death. I'm your host, Ris,
And I'm your host, Dee.
and we have a special guest here as well.
Besides our mom.
We have, I'm just going to go by, is T okay? Okay. Because we do our nicknames. Do you want TNT? Yeah. And we have a special guest, TNT.
Oh, hello.
I love it. If you're new here, welcome. We are two nurses that like to talk true crime, and we like to focus on cases that have a heavy medical influence to them or cases that feature a medical professional as a perpetrator or victim.
So let's get into it.
So without further ado, let's do this. Okay. Today we're going to be talking about Munchausen's by proxy case that resulted in the unfortunate death of a child.
When I think of Munchausen's by proxy, I think of Gypsy Rose Blanchard.
Yep.
Who we also covered.
We did cover that case, and she's free, and I think she's pregnant. Basically, Gypsy's mom had Munchausen's by proxy, and she kind of created medical issues in Gypsy. So Munchausen Syndrome by proxy is a mental illness, and it is also a form of child abuse. It's when the person that's taking care or responsible for taking care of the child ends up either making fake symptoms up or creating real actual symptoms to make it look like this child is ill. Sometimes these caretakers can do really extreme things like withholding food so it looks like they aren't able to gain weight, making up fake lab results, giving a child drugs to make them vomit or have diarrhea episodes, that kind of thing where they create illness in their child to obtain oftentimes attention.
I just want to jump in quick. It's not that they want their child to be sick or this other person to be sick, because it's not always their child. Mm-hmm. Most oftentimes there's a power dynamic that allows a parent to do this to the child and it go undetected.
Yeah.
And I just want to stress that, like Ris said, there's a secondary gain. It is that attention that they get in turn from healthcare workers.
Yeah.
So it's something that we as healthcare workers need to be always vigilant about.
So as the non-medic, non-expert here, can you describe any other illnesses that maybe like the public is more acquainted with that it's like similar to this illness?
Similar to Munchausen's?
Mm-hmm.
Oh, geez. I don't know. Dee, tell us, because this is a psych issue. That's an excellent question.
TNT, excellent question. So off the top of my head, fictitious disorder is a possible differential. Child abuse, so a lot of the things that go on in Munchausen's by proxy, the motive behind it is an attention-seeking thing, and some similarity to what might be considered as child abuse in that situation. Somatic symptom disorder. It's a disorder where a person will have physical symptoms that are distressing to them, but there is not a deliberate intention to deceive the healthcare workers. Malingering, that's someone who's trying to get a secondary gain, thinking for secondary gain. And yeah, that's a great question that I would never have thought to ask. So thank you, TNT.
Yeah. And do you know if there's any like medications that people usually typically take when they're diagnosed with this? Is it incurable?
They usually treat the symptoms, if I'm correct. So if there's like an underlying anxiety, mood disorder, they would treat that.
Definitely like therapy.
You can do individual and family therapies. I don't know what the gold standard would be in terms of Munchausen's, but I can find out for you. And also there are some legal considerations too, especially from a healthcare worker, mandated reporter sphere. If there is a suspicion of a child or an older person being abused, we are legally required to report that. So that would be another consideration. I think Ris mentioned therapy, psychiatric evaluation, see if there's any underlying mental things or mental or emotional things going on, and going from there.
Anyway, we'll see that theme today because was suspicion throughout this case, but unfortunately it was never, there wasn't much that was done about it. Anyway, let's get into this. So this is the case of Lacey Spears. She was born on October 16th, 1987 in Decatur, Alabama. And she grew up with a love for children. She worked as a babysitter before getting a job at a daycare. One of the moms at the daycare remarked that Lacey was really good with kids, but that she seemed overly involved in their lives. She began taking classes for nursing school where she met a woman named Christy who also made a similar complaint. She even recalled a time when Lacey tried to pass off Christy's son as Lacey's own child. Lacey ended up dropping out of nursing school before beginning to date a neighbor named Chris Hill. Lacey got pregnant in 2008 at the age of 20 before giving birth to a baby boy named Garnett Spears on December 3rd, 2008 in Decatur. Lacey raised Garnett as a single mom, saying that Chris wasn't interested in being a dad. Garnett struggled with a lot of health issues right off the bat, starting within the weeks following his birth. He had severe ear infections and difficulty eating. He would projectile vomit and really couldn't tolerate eating. When he was 9 weeks old, he underwent stomach surgery, which didn't change much, according to Lacey. And she said that they returned about a week later, and he was hospitalized at 10 weeks for dehydration. And he actually ended up being transferred via air transport to another hospital because his sodium level was 166. And that's high for a sodium level. Normal sodium level is 135 to 145. And when your sodium is high, for example, you can have increased risk for seizures, cerebral edema, or swelling around the brain. And it can be really dangerous, especially for babies who have trouble regulating just in general because of their age. So they end up getting his sodium under control when he's 10 weeks old, and he's discharged. But the struggle continues with his health. At 9 months, he underwent a surgery again in order to have a G-tube placed. This way, he could be fed through the G-tube, and it goes directly into his stomach. So he doesn't have to go through the process of eating physically to, get nutrients and to eat to sustain his life. He would just have meals put through the G-tube, like supplemental feeds through the G-tube so that he can have the nutrients that he needs. In 2010, Lacey and Garnett end up moving in with Lacey's mom, Peggy, in Florida, where Lacey kind of did odd jobs to make ends meet. She babysat, among other things. And by the time Garnett was 3, they moved to Chestnut Ridge in New York. And the two of them lived in a sort of assisted living community called the Fellowship. Lacey was able to take care of the elderly residents in exchange for room and board, and also they provided schooling for Garnett. One of the residents, named Valerie, remarked that Garnett was special, that he knew how to reach every person and make them smile, and that he was very full of love. By 2013, he still had the G-tube in place, but it was used as a supplementation to Garnett's eating by mouth. So at this time, he was eating, but Lacey said he was using the G-tube for supplemental as needed feeds.
How old was he at this time?
So by 2013, he was about 4 or 5, and he still had the G-tube in place. Lacey said that he was still having stomach aches and not eating enough. A pediatric doctor, he was a gastroenterologist, his name was Dr. Darren Cove. He took care of Garnett for a few months, and he remarked that he was healthy and that he thought it was odd that the G-tube was still in there. And Dr. Darnkov said that he and Lacey had talked about this multiple times. Like right off the bat, he said, our goal is to have that G tube out. Like, it's not supposed to be a long-term thing. If he's eating my mouth, we need to get him off it. And so they had that conversation about removing the tube, but it never happened. The doctor said that Lacey wouldn't go through with making the decision to have it removed. She just kind of didn't really say yes or no. It just never happened. And he always verbalized concern to Lacey about it still remaining in place. But he said he was somewhat suspicious, and he said it had crossed his mind that maybe they were dealing with Munchausen by proxy. A psychologist named Dr. Saunders, who was an expert on Munchausen by proxy, explains that oftentimes a G-tube can be a really dangerous thing for people who have Munchausen's by proxy because you can put anything through that G-tube. You can give them anything you wanted, to create a sick child.
I had a question where, as someone, because you both work in the medical field, if you're ever suspecting that, a parent has that disease, like, is there anything that you can do when the baby's life is at risk? Is there anything in your power to do, or is it something that you can't really do unless there's, like, really specific evidence for?
Let me just clarify first before I answer this question. So Garnett had hypernatremia, which is high sodium. And the doctors did not know why he had it when he was a 10-week-old baby. They didn't know what was causing his hypernatremia. But so anything suspicious where what you're seeing doesn't really make sense. And any basically, like Dee said earlier, anything suspicious or where the picture doesn't match what it kind of should be, there's no like reasonable reason why, this kid has hypernatremia, or just as an example, hypernatremia, but then you would need to create a report based on that. And we go through the appropriate reporting agency so that you can have it looked into further. And like I was saying, this did happen eventually with this case, but nothing ever happened, unfortunately. But, you do what you can to help it come to light, but it doesn't always work that way, unfortunately. So anyway, Dr. Saunders, the expert on Munchausen by proxy, says that there is a clash, like I just said, where the story doesn't meet what the child looks like. For example, mom is saying, he's not eating enough. He's not, I have to do the supplemental feedings because he's not taking in enough nutrients by mouth. But you see a healthy kid within like the normal weight range for that child of that age. They don't look like they have any signs of malnutrition or dehydration. So what they're seeing doesn't look like a kid who's not meeting the needs of their body. Does that make sense? Mm-hmm. And Dr. Saunders also says the motive behind Munchausen by proxy is often due to needing that attention. And this is even more sinister when you find out that Lacey has been using social media this entire time to shed light on their struggles with Garnett's health. And she also had a blog that focused on her journey of looking for a cure for Garnett. So yes, people document their struggles with health and their children's struggles with health, and I think that's a good thing. It's a supportive, a way to obtain support and more resources. But in some cases, it can be more sinister. Like this one, it just seemed like an avenue for her to get more attention. So Garnett and Lacey are living in the fellowship, that's the assisted living, for about 1.5 years, and Garnett is doing well. Feedings are occurring just occasionally as needed. He's doing okay. But in January 2014, at 5 years old, he develops a fever. And he begins to complain of a headache and a stomach ache.
Oh, no.
So Lacey takes him to his pediatrician, and they decided, okay, we're just going to watch and wait, see if we need to intervene, but maybe he's just got a stomach bug. But a few days later, Garnett ends up screaming in pain and holding his head. They go to the ER and he gets admitted to the hospital for seizure-like activity. And he is also set up to an EEG machine to monitor the activity in his brain. And they also had video surveillance to keep a close eye on Garnett.
And that's very typical for when people are on an EEG.
Yeah.
In that type of setting, because they want to be able to actually see the patient and see if there's any indications, not just based off of what the EEG is showing.
Yeah.
Does he still have the feeding tube at 5 years old?
Yes, they still have not taken it out. This boy has had it in for over 5 years. While he's in the hospital, Garnett's symptoms start to improve. But 2 days later, while he's still hospitalized, he starts screaming again in pain. And they end up calling a code blue because he stops breathing. End up doing repeat labs. His sodium on admission was normal at 138. But now it was a whopping 182.
Oh my God.
That is dangerously high. So he's airlifted to another facility and his sodium is back under control by the next day. But it was too late. The effects of the hypernatremia were already done. He was brain dead and on a ventilator, and he had endured too much swelling in his brain. So at this point, doctors are baffled. There's no reason why his sodium level had increased so much unless someone was responsible for it.
What was she giving him?
Just wait. Hospital staff begin to involve law enforcement because they quickly grow suspicious of Lacey, understandably so. Police end up searching Lacey's home and see medications on the table behind a large can of salt. There was an IV pole in the living room with a substance that looked like breast milk attached to it, and they also find a bag similar in appearance to it in the garbage. But they didn't take either of the bags because Lacey had told them that she was breastfeeding, so they just assumed it was breast milk, I'm guessing.
Wait, hold on.
Wait,
I know.
wait, but she doesn't have another baby.
I
Was
know.
breastfeeding her 5-year-old.
I know. That confused me, but I didn't see anywhere that she had another child. Oh, let me look it up real quick before I say that.
She pulled Eliza Aaron from Game of Thrones.
Oh my God. Yeah. Yep. She just has the one kid, so I'm not really sure why she's breastfeeding or how she's breastfeeding at this point.
So the cops weren't really suspicious at this time.
They were suspicious, but they did not take this breast milk or this substance
Fascinating.
that they thought was breast milk, the 2 bags. But this will come to light later. So Lacey was cooperative throughout, interviewing the police. She seemed to want to be involved in the investigation. The day after Garnett's death, Lacey asks Valerie, this is her neighbor at the fellowship that said those kind words about Garnett. She asked Valerie to remove the feeding bag from the IV pole in the living room and get rid of it. Valerie agreed because she just wanted to help Lacey. Like, okay, you're going through a lot. I'll do whatever I can to help you. And so Valerie goes over there to get it. And another neighbor tells her that the cops had come over to Lacey's home. And Valerie decides, okay, I'll take the bag, but I'm not going to get rid of it just to be safe. And she stores it in her closet and tells the supervisor at the fellowship about this weird situation that just happened. And they end up telling the police, and the police retrieve the bag from her, plus the other bag that was in Lacey's house in the garbage. They send off the 2 bags, and not surprisingly, there was, guess what?
Salt.
Yes, TNT, that's correct. Salt.
But how was it breast milk with salt, or was it like whatever fluid so condensed it looked like breast milk because of the salt?
I think this is what I think. I think it was so like a heavy concentration of salt that it looked milky in appearance.
That's crazy.
I don't think it was breast milk, but I don't know for certain. if it was just mixed with salt.
It's a whole
You know
different
what I mean?
layer of twisted if it was breast milk.
I know.
At this point, is it only just her and her son, or is her partner also involved? I can't remember.
So Chris is Garnett's dad. And when Garnett was born, Lacey had told everyone that Chris did not want to be a part of Garnett's life. So she was a single mother at this time.
What I think happened is that she is probably someone who does not have a lot of medical knowledge.
Yeah.
She tried to get into nursing school. She saw them react so significantly when this baby had hypernatremia or high sodium, and she recreated chasing that high for the attention. That's my personal never had contact with this person. This is my armchair analysis.
Thank you to our local psych nurse for that idea that I never would have thought of. Okay, correlation and causation. I have to take a stats course, so I learned all about causation.
Beautiful.
Okay, yes. So there was significant amounts of sodium in both bags. Each bag had the same amount of salt that is in about 69 small packets of salt. And this was considered a lethal amount. The coroner ruled Garnett's death a homicide. Lacey Spears was arrested and charged with first-degree manslaughter and second-degree murder. Looking back, Lacey had a history of instability and a lot of red flags. I saw a couple different things about Garnett's dad. One of them was that Lacey said that Chris didn't want to be a part of Garnett's life, but I also read somewhere else that Lacey kept him from Garnett, stating that he wasn't Garnett's dad and explaining that his actual dad was a man named Blake, who was a police officer who had passed away during a car accident. And this Blake was actually a real person. He was a sergeant with the Morgan County Sheriff's Office in Alabama. And I guess he briefly knew Lacey. But Lacey had made several posts about dealing with the loss of Blake on her social media, including writing about traveling to his memorial service. Just a lot of stuff that, obviously was hungering for attention. Chris, on the other hand, said that Lacey had shut him out and didn't let him into Garnett's life. Throughout Garnett's short life, they were seen at 20 different doctors' offices. This isn't 20 visits. This is 20 separate doctors' offices that he was seen at. Several of them voiced concern about Lacey's role in Garnett's illnesses. When Garnett was only 5 weeks old, one doctor wrote their concern down in the medical record that they thought it might be Munchausen's by proxy. There was another report that Lacey voiced that she wanted to hurt Garnett. Another doctor wrote of an incident where Garnett was bleeding from the eyes and ears, which that's all I read about that. I don't know more about that. And of course, a high unexplainable sodium level at only 10 weeks old was another red flag. Several reports about possible child abuse were made, but Lacey was ultimately cleared each time. And let's just talk about this video surveillance for a minute. Lacey brings Garnett to the bathroom 17 times throughout his stay. 2 of these times, she brings in feeding tube supplies to the bathroom, which she says she brings it in order to clean them. And defense argued, okay, she left the door open every time she went in there, to the door to the bathroom to open every time. Prosecution points out that after 2 of these trips, Garnett falls ill right after coming back from the bathroom. He ends up intubated after the second time that this happens. His sodium level was checked that day that he ended up coding. They said in that 5-hour period, his sodium went from 144 normal to 182 within 5 hours. Furthermore, Lacey had been Googling. Of course, they always get you here. She had been Googling about sodium, signs of hypernatremia, dangers of hypernatremia. Very shady stuff. Evidence presented in court suggested that she intentionally inflicted harm on Garnett, including starvation and physical abuse. During the trial, it came to light that Lacey had Munchausen Syndrome by proxy, so she was not given the maximum sentence. In 2015, Lacey was found guilty of second-degree murder and was sentenced to 20 years to life in prison. She has complained that other inmates bully her, including putting salt packets on her food tray and dumping salt into her food. She will be eligible for parole on June 12, 2034. This case raised a lot of alarm surrounding the effectiveness of, child protective services and the systems that are already in place to watch children that might be at higher risk, like Garnett was. Advocacy groups also helped advocate for changes for better supports and interventions for families who might be going through similar situations. I think that there probably is a record for previous reports that were filed so they could see oh my, there was a lot of concern, but unfortunately, I feel like sometimes it's not given as much attention as it should be. I think he did slip through the cracks for sure.
Question I had. So statistics wise, how common is this in the population?
Let me look at it.
And also another question is, now, parent-child is pretty common, but is there ever someone doing that to an older person who might not be able to communicate their rights that well? Or I don't know, how common is that?
I think a little less common, but it can happen in older, an older parent or an older person that you're, the caretaker of. It can happen, definitely. Anyone who's vulnerable, like children, older patients, patients who may have intellectual disabilities, because it's unfortunately easier to take advantage of them.
In terms of incidents, they say that roughly 1 to 2 cases per 100,000 children annually. And keep in mind, this can often be underreported, missed. So that's a very conservative number in terms of it. I also thought it was interesting that 80 to 90%. Yes, that's in the United States. 80-90% of cases involve females being the perpetrators. So usually if it's going to be someone, it's probably the mom. There have been cases where men were the perpetrators, but that's far less common. Research shows that 3 to 4% of pediatric patients as a whole with unexplained medical symptoms may be victims of Munchausen's by proxy. You also ask about the elderly, and again, that is considered to be much more rare, because typically it's in children. But it can make it even harder because the elderly people may not have their mental facilities, and they have a lot of different pre-existing medical comorbidities that I think would make it much more challenging,
I think it'd be harder to pick up in a older adult, because so much can it can happen and things can go wrong at any age, but I feel like it can be more, some things can be better explained in older patients, than if you see hypernatremia in a older adult versus a 5-year-old. It's you'd think more. I feel like there's a wider range of reasons why that can happen in an older adult.
And I feel like a lot of times things get dismissed too. Like if you could hear a patient say, oh, this person is doing this to me.
Yeah.
Healthcare workers might just assume, oh, this person has dementia, they have an underlying cognitive issue, impairment. They don't take it as seriously.
Yeah.
But it's something that should still, and
Yeah.
again, every situation is different, but there should be consideration given that there may something more insidious be going on.
Yeah.
So excellent point.
Excellent.
TNT. Great point. That's serious, because I wouldn't think of that.
Me either.
I wouldn't say, oh yeah, does this happen? I would be like, oh my God, what? You threw me off. But, you allowed us to learn something as well. So thank you.
But I agree. And I'm glad you brought up that point that when, like, if an older adult were to say, oh, I'm being poisoned, or, this person is abusing me. Yes, sometimes they unfortunately aren't taken seriously because of those issues that you're talking about. But also with children, they can't verbalize it, or if they do say like, oh, mommy did this to me, or, she's making it seem like, if they raised a concern like that, they'd probably be dismissed as well because, oh, you're a child. Like, you don't really, either you just kind of assume that they don't know what they're talking about, or, a child doesn't know how to convey that to a healthcare worker, or they think that it's normal. You know what I mean? But it's just sad that people take advantage of the vulnerable. Anyway, that's really the case. I just wanted to talk about it because I don't know, I came across it. I remember hearing about this case a few years ago, like of a mom who used salt to, induce hypernatremia in her child. She was suffering from Munchausen by proxy, and this poor child suffered hugely as a result.
I do have a question.
Okay.
So I'm curious. So this one, you covered salt, and then you said that a past case you also saw salt. Is there a reason why salt is like pretty common? Is it like kind of like the slow burn kind of thing that you can give a kid where like they're not most likely to die, but it can kind of, be stretched out for a long period of time before going detected? Or what other ways have people with Munchausen's by proxy, like what other methods have there been reported?
Actually, this is the only, I was talking like about this case, having heard of this specific case a couple years ago.
I know Gypsy Rose Blanchard's mom said all of her teeth were rotted and ripped all of her teeth out of her.
Yeah.
And it's like, that's just cruel and unusual. Her mom said you can't walk, you have to use a wheelchair. And Gypsy was like, oh my God, I can walk. What? Like, imagine being told your whole life, you cannot walk. TNT, you cannot walk. And then one day you realize that you were lied to this entire time.
It's also insidious because when, like for Gypsy Rose's case, Gypsy actually thought that she was ill. She thought, she couldn't walk. She was paralyzed. Yeah. I think Gypsy Rose also had a feeding tube as well because she was, taught that she could not eat normally. She shaved Gypsy's head to mimic the effects of chemo. She dressed her in like more infantile clothing, much younger than her age, homeschooling her instead of having her in like a public school system, to kind of limit any interactions with other. It is abuse, for like point blank. Munchausen by proxy is abuse. Dee Dee said that she had like leukemia, muscular dystrophy, epilepsy, visual impairment. That just was simply untrue. She was a healthy, normal kid, which just is, I've never been in a situation, so I can't say, but that's, horrific. And, Gypsy, her and her boyfriend ended up killing her mom. But, there's a lot of, it's very split. People, she just got out of jail, like I said. But there's a lot of different opinions because, she's abused. She's trapped in a house with her mom who's abusing her. And, that she thought that killing her mom was her only option. So it's just really difficult. All right, everyone. We appreciate you all. TNT, thank you so much. Our good friend TNT is here, and our mom. Really quickly, we just wanted to recognize the deaths of two important lives recently. So it's been a little difficult. Dee lost her beloved Jack. For those of you who don't know, her German Shepherd, who is her baby, which has been really difficult for her especially. And also the loss of our uncle as well, which has also been really challenging for our family. But we just wanted to add them in here because we're thinking about them. But thank you all for listening. We appreciate you and we appreciate all your support. Are you ready to call it? T, do you want to call it?
And that's a wrap.
And that's a wrap.
The time is 1927, which is 7:27 for all you non-medical, non-military folks.
Good job, TNT.
And she's not medical or military, and she killed it.
You killed
I'm
it.
just a wee citizen.
Well, we love you for it. Okay. Thank you all for tuning in. We'll see you here next week. Bye.
Bye.
Bye. Peace out.
Bye.